So this is kind of what I wrote and was hopefully it's been circulated from last week. And I'm sorry I've not been in touch a bit. We've had a little bit of entertainment this week, but we won't go there. So we talked, just to remind those that were or were not here. We talked about literature review of two types, looking for authors and then looking for anatomic and disease taxonomy. So that's something that we need to set up. We said that we thought that a formal Delphi would be required, and that we would construct questions according to the various definitions in the literature, and use an image as a prompt to refer to when answering the Delphi questionnaires.
Could we just back up really quickly? I know all of you, but I don't know if everybody on the call knows everybody.
Apologies.
No problem. Do you want to do a quick
Yeah, so
round
I'll
robin to
do
make
me.
sure everybody
John
knows everybody?
I do apologise. I know the names. John Edwards, thoracic surgeon in Sheffield in the UK. Yes, sorry, I should have done the introductory bit
No,
first.
that's okay. I just wanted to make sure we're all on the same page.
Yeah. So
Do you guys want to go Brady Bunch, Dr. White? You're top left on my screen.
Sure.
always.
Tom White, trauma surgeon, Salt Lake City, Utah. Currently the chairman of the board of directors for CWIS, and happy to be here. A bit of an interloper today, but I want to learn about this as much as I can. So thanks.
Thank you. Next on my screen, Dr. Bauman.
Yeah, hi, Zach Ballman. From Nebraska. Trauma surgeon. Sorry, I'm post call today, so my brain's not firing on all cylinders. Yeah, trauma surgeon over here in Nebraska, Omaha, Nebraska, University of Nebraska Medical Center.
There you go. That says it all. I'm from Nebraska. It just kind of summed it up. I like it.
Corn-fed over here. Corn-fed.
Next on the boxes, Dr. Risk. Good to see you.
Hey, I'm Nathan. I'm one of the general surgery residents here at MUSC in Charleston.
Sounds great. Dr. Hahn.
My name is Julia Hahn. I'm new to the group. I'm an anatomist at MUSC in Charleston.
Great to have you. Dr. Erickson.
Yeah, so Everett Erickson, president of CWIS, chest wall enthusiast, Nathan's boss, and Julia's co-worker. So Julia, I'm the reason that we got those two in here. Julia is my new best friend in the anatomy lab. My previous best friend retired, so I had to find a new friend. So I found a new friend and was talking to her about this and thought she might have some great insight for us. So I asked her to join us to see, one, if she likes working with us, and two, to see if she can help us better define this anatomy.
I like it. You took that whole, Gallup, make a best friend at work thing really to the next level. I like that about you. You channeled your
straight down to the cadaver lab.
She's obviously very
that's
new.
a good place to meet a new best friend.
Exactly. He's like, if they say I need a best friend, I'm gonna head straight to the cadaver lab. So that's solid.
Well,
a solid idea.
As you guys are aware, I have no friends, so I have to find them at work where they have some association with me.
Solid points. Solid points. Dr. Satori.
I'm Hungary. I'm an orthotrauma and general thoracic surgeon, and I'm driving now, so sorry for the echoes.
No, that's fine, David. Thank you for being in touch. So apologies. So I'm going to jump straight back to where we were.
Please.
We talked a little bit last week. Talked a lot about last time about kind of methodology of this aspect and the need for getting this done quickly, which is the challenge that we need to try and rise to. And there are going to be times when some of us do and some of us don't. So we thought we need to do a literature review to identify authors who we might want to get involved in the group. And I'll come back to the size of the group in a minute very quickly. And we talked about the need for a literature review to determine both the sort of anatomy and disease taxonomy, these being two different threads of the sort of taxonomy part. And construct questionnaires accordingly and run a formal Delphi using the formal Delphi platform. We talked also about the use of a diagram, and the one that I shared last time, I think was this one, which we thought would be a useful starting point because it has, oh, that's gone on the wrong screen. That's no good. So it shows a good a good idea of how all the different types of joints that we have, and I need to finish labeling this up, which I've not quite done yet. But that will allow me to allow us to have a create a handout that we can give to people and get them to refer to it when it comes to answering questions on the Delphi process. We talked a little bit in terms of the Delphi itself, which I kept. It's actually on a slightly different sheet, but effectively it seems that probably 25 to 30 people are likely to be involved in the answering of questions on the basis of it being the right size for the license, the right size for the group. There will be people outside the group that we may want to identify to include in the surveys. And that we would then review the results, present them, and then redo accordingly. In essence, in terms of trying to get the tasks done sufficiently quickly, we need to try and get this set up within the next week or so, which is rapid. But that would give us potentially 2 weeks per round, and then a little bit of breathing time in order to be able to present something for the date of the Boston meeting on 13th September. It also gives us a chance for those of us that are going to be at CWIS International to have a quick discussion there and make sure that we're up to speed for that meeting 10 days later. So it's going to be and it's going to be a challenge. So effectively, what I then did was to circulate this this document to try and throw some terms out there, which then allow us to pull in some of the literature stuff. So there were different types of joints. I'm going to try and put the two next to each other, which is usually probably going to end in tears. But I think it may be the best way of doing it. I'm going to put that one up there. I don't want to make it too big, but if I leave that there and then put the I've got too many things open at the moment, and it doesn't want to do it how I want to do it. I'm going to have to minimize the other things. Apologies, we will get there soon. Here we go. So that gives us the opportunity to think a little bit about these different joints. And as I explained, the terminology I use I don't like, but it may be the best way at the moment, at least as a starting point. So the yellow circles are joints where you have side-to-side type joints. Now, whether these are best called side-to-side or bridging or quite what, I don't know. But I think what we need to do before we actually send out the questionnaire is to use the literature search and our own opinion to come up with as many different options as we have for the different types of joints that we see on the diagrams. So what I need to do is I need to circulate the numbered diagram very quickly so that we can then come up with all the different terms that we've got, and then we can construct the questions. I think that's really the action from tonight as much as anything else. And then we've got the kind of, the side-to-side joints, which I've tried, the ends-to-side joints that I've tried to come up, whether we call that a tip interchondral joint, I don't know, but we need to come up with some terminology there. In terms of the true costal cartilages, false costal cartilages, floating costal cartilages. Again, I think it's possible potentially to define those, and I think these definitions might actually stand the test of time. And that's how I think things were as we were there. So in terms of the taxonomy, I think the action points that I need to do is I'm going to take this diagram and then number it so that you can see the different types of joints that we've got here, and ask people in this little group, can you come up with all the different possible names that you can think of for the types of joints that will be numbered. And then we can construct the questions from that for the anatomy, and we can use the literature search. Thank you, Everett, and others. We can use the literature search to pull that in as well. I thought I'd save that, but I've not. Sorry, I've got to find that again. I do apologize. So I mean, this is really good. It comes up. There are some extra words in here that I've not heard of before, which I think are quite useful. So we can include some of the terms that we're seeing in here for the purposes of this. I don't think we necessarily need to define the type of joint in terms of synovial, primary, secondary, cartilaginous. I think there's plenty of literature about that. It's more about the names of the different types of joint you'll see on a scan that I think is what we need to address here. So I'm just going to throw that out. Any thoughts in terms of comments so far about the next steps for the anatomy aspect? I'm very happy to have no particular comments.
So it sounds like the next steps would be then the creation of the questions.
Correct. And I think what we need to do, as I said, we need to just populate the questions with, interchondral. I like the synchondrosis or whatever it was called. I think, there are some other interesting terms that I've not come across in that literature review. Thank you for that. Because, we just need to populate a diagram with the possible terms that we think we could use, so that then we can ask when we create the Delphi, we can ask people of their opinion on that scale of 1 to 9. How frequently would they like to use this term for this joint? And then we ask them the same for the other type. And it's going to be a bit long, but that's the way that it's going to be done automatically. I think I've got my head around this correctly. So, we'll have 6 different types of joints, perhaps. And for each of those, we might have 4 or 5 different possibilities to use. So for joint 1, we will have to ask, is this a type A joint? Do you agree? Do you not agree? Or is it a type B joint? Or is it a type C joint or a type D joint? And then for joint 2, we have to ask similar sorts of questions, but the choices will be slightly different. But that will allow us, I think that is the way to construct it, to allow us for it to run automatically.
So the parts that you want to be Likert scale are, because you're asking, is this joint? Yes or no? And then the Likert question will be the secondary question of how likely are you to call it this thing?
So I think the way it works in terms of that scale is that we have to have separate questions, and I think because we're asking people to choose their favored option between 4 or 5 different choices. That's effectively what we're doing. So we've got here is a picture. Is this a, what do you think it is? Is it A, B, C, D, or E? But I'm not sure that the way that system works will allow us to just ask people what their favored option is.
Well, so it would allow you, so like here's the current one we're running for length of stay, right?
Yeah.
I'm just trying to imagine how, and we can insert a picture. I was practicing with that. I'm just not clear how we're gonna make that a Likert scale, because
I
if
know.
you're just asking about a name, an individual, you're basically asking a multiple choice, not a scale. Because you're
Correct.
saying pick A, B, C.
Yeah.
And that might be
Yeah, but you
fine, but that's
can
not
ask.
necessarily.
we could make it. You could make it a Likert scale though, John. We could say
Right.
like how important is it to call? I'm just going to throw how important is it to call
This
slipping rib syndrome, 10th rib hyperlaxity, or whatever we want to call it. And you can say on a scale of 1 to 9, 9 being like most important, 1 being least important. You could have them ranking in between.
But I'm just not sure important is the word that
I
anyone
know.
would like. We have to think of what that adjective
Like
is, like,
something about like how
or adverb is,
does it
like.
make more sense to call,
How
does it
about
make
the
more
word
sense?
the word appropriate, or
Is it more appropriate to call, how appropriate is it to call to change slipping rib syndrome's name from to 10th rib hypermobility, or whatever we want to call it? You know what I'm saying? Like Tom said.
There's our appropriateness question.
I mean, I think what John was talking about before, where we may have, 4 or 5 different names for the same joint, you could run individual questions. How appropriate is it to call it this joint an intracondylar joint? How appropriate
Yes.
is it to call it a
synchondrosis.
synchondrosis, whatever?
That's the point.
But maybe it
effect-
doesn't have to be a Likert scale in this one, because you are still giving them lots of options. You're saying, do you call it this? Do you call it this? Do you
Yes.
call it that? Like,
Yes.
it's not Likert. I mean, because there are, well, I don't want to change this one because this is an open survey. Let me open a new one. We're just going to make that up for the moment. But if we were actually creating this survey and we're adding, they do have, I mean, you can do a multiple choice question, and we could ask them, if we do them with the boxes, we can ask them, check all the things, which of these, as you look at this image, which of these items would you call this? Or we can do it with radio buttons and say, which is the most appropriate descriptor
So we can do it
for the
so
image.
that makes it massively easier.
We can. It's just that's the, there's definitely, I think well, yes, we can definitely do it that way. The other thing we can do is, they don't have a good visual
Rank
here.
order. I like rank order.
That's true. We could do a rank order. Like, how would you rank these, or what's the most.
How do you rank these terms?
Right. Based on this image, how would you rank these? We can do that one. They have a sliding scale one that you could use. Where's
I think the rank is perfect because, and you
boy, it'd be tedious to rank all of them though. How about rank your top 3?
right.
Yeah, well, whatever. Yeah, exactly. You're only going to get 5. I mean, you're not going to get 7 different ways of describing, each individual joint, I don't think.
Right.
And you're right, you know, check your top, or rank your top 3 or whatever. Yes, no, indeed.
There's the slider one, but you can do them with
this again is a
sliders.
this is again a how likely are you going to type
Right.
situation, isn't it? And I'm not sure. I mean, we can use the how likely are you to use this term, but I think
Yeah.
ranking is much better. And if there's a way that you know, it can be a rank order can be run within the Delphi, that would be perfect. I think we just need to run it. I mean, we always need to dummy run it and amongst ourselves, perhaps.
Yeah, we can definitely do that.
Or even within the 20-odd committee, and just run it and see what happens. And if that's good, then we can add in the extra people that we might wish to include.
We can definitely dummy run it. Once it's
So
there,
that
then
makes it
we can
that
we
makes
can do
it
that.
really easy, because effectively that kind of ends much of the discussion that we need at this point, because what I need to do is to assign the diagram with numbers and just ask people. So I just need to spend
Yes,
that
and then we
doing
can
that.
pop the image in, right? Like this is where the image goes, right here. So we'll have a question here, the image will go here, and then we'll dummy and we will put the rankings right here.
Okay,
So that'll be the layout
excellent.
essentially.
So that I think is that will work. Perfect. Can I go back to sharing?
Yes.
Have we got are people happy with that's what we're going to do in terms of the plan? And the plan will be to me to provide a diagram, us to consider from the literature search, and you know, all the possible terms that we could use. We can start writing the questions. I know we're repeating some of what we said last week, but that's going to work. This little bit of extra discussion is very helpful. So for the anatomy side, I think that's really good. And the and then to some extent it was a matter of the how we do the if I'm going to I still do like the idea of functional chest wall disorders. I came up with a little bit of extra work after the meeting to try and come up with a definition of what functional chest wall disorders are. I hope you've had a chance to read that. I don't know, but that seemed to make sense to me. There's a bit of overlap with trauma because some of them may result from trauma, but it's not necessarily a fracture that we're dealing with here. And again, I think considering it's a question of how we do it. This is a little bit more difficult with a Delphi because effectively what we're almost asking people, are there any other you know, what are the different, so it's more on the literature review, you know, what are the painful disorders that can affect the thorax, the skeletal thorax, and then how do we create a definition for them? There is a little bit of Delphi work again in terms of, for example, here, how should you define? That's probably excessive motion, or pathologic motion, or even both those, excessive. And so that, you know, there is some Delphi work here in terms of what is your favored term for those. But I'm kind of not going to go much further than what we said last week, apart from just to show that there. Any comments about what you're seeing on screen there? Does that kind of make sense, even though it might not be final?
Yeah, John, I think it makes sense. With respect to the Delphi, though, should we look into not only excessive movement but also lack thereof? Do we need to define, you know, non-movable, slight movement, hypermobile?
Yeah, I mean, it would make sense that we probably define the amount of movement, right?
I mean, going back to the rib fractures, we talked about, non-displaced, partially displaced, fully displaced, simple, wedge-shaped, comminuted, etc. Seems like we need to get a little into the weeds of the joints themselves and or the ribs.
So in other words,
Their
what is
degree
the
of movement.
normal, what is the normal motion of each of these joints?
Right. Because we're trying to set up the taxonomy by which we report pathology. So you have to have normal, and then you have
Yes.
to have abnormal in both directions.
So how many of these joints has anybody ever tried to define? I mean, I'm fearful that we might end up in treacle trying to define, how much does a manubriosternal joint normally move? I don't think anyone has ever made any attempt to try and measure that. So I don't know that it's possible to define normal motion. So I mean, you could describe pathologic motion or lack of, in terms of painful motion or painful stiffness. I think it may be that we have to define that. I'm not sure that we can necessarily define normal motion.
Yeah. I think that's fair. And I agree with you. The upper rib cage, who knows, and nobody's really looked at it. My head lives on the costal margin, so that's where all my thoughts normally go.
Yeah. So I'm just making some comments for myself here. My typing shit, by the way, don't judge. Okay, so that's a start. In terms of actions, I'm going to just add on here. So the literature review, we've seen some of that. So personnel, I think, is completed. I'm going to put that down for now. I'm doing it the UKY. Apologize that I've got it this way around. So I could even do it the other way around for one column and the other for the other, just to really annoy people. So the literature review we've kind of done. That's done for for anatomy. I think is there much more that we can add? So does somebody want to talk to me about?
Since I had to hop off the other call a little early, I wasn't quite sure what I was doing the lit research for, but I did do a lit search for slipping rib syndrome, 11th rib syndrome, and 12th rib syndrome, and they all kind of discuss some of the anatomical features of that as well. So I have a list of all those. There's obviously the most is in slipping rib syndrome, but very little in 11th and 12th rib syndromes.
So that would be really useful. So if that's in some form of even a Word document, Zach, that would be really good.
Yeah, I'll send it out. I have it in a Word document. I can send it.
See that. That would be really helpful. So we're kind of, we started doing this already, haven't we? So that we can put in correctly. So I think this is just a little bit behind, but this is that the labeling is going to get finished tonight. I should think. In terms of determining initial search terms, I think what we need to do is we just need to have a look and see what we've got, because we may find that we've got enough. We may find that we're not going to find anything else. I mean, Nathan, do you have any comments, or Julia, do you have any comments so far in terms of the anatomic terms? I'm not sure if you've had the opportunity to see this. You, of course, one of you will have done, but is there anything else that you want to add to the literature search and the words that come in here?
I probably got about in one of the paragraphs there about a half a dozen different terms for kind of interchondral joints or intercardialis attachments or synchondrosis. And after reading probably 15 to 20 articles from different specialties, I couldn't find much more than that between radiology, orthopedic trauma, thoracic, and then kind of some of the chest wall anatomic research. So
Yeah, and from our standpoint in anatomy, it's a thorough list. I've pilfered through some of our textbooks, older texts and some of our newer texts, and couldn't find anything that wasn't included in that list already.
Okay, that's really helpful. And you know, as I said, I think from this file we're going to likely find all the terms that we need. What I'm going to do is I'm going to just trying to think. I might even put it in Google Sheets or Google Docs rather, and just share a link so that we can just work on that in real time together, whoever, whenever. That's probably going to be the easiest way to do it, I think. I mean, I know there's other technologies that allow us to do that, but I think if I do that and then we can, you know, go through this document together and very quickly and just make sure that we get all the terms to the different numbered joints that I create from my pictures. So I think this is the picture. Sorry, it's come out of I've changed computers and it's all come into, all the numbers are gone. But that was the picture I was going to use because I think that's got all the different connections and all the different possible ways in that one picture. So by the time I put some numbers on here, that will then make it easy for us to come up with the possible terms for each one. And similarly, once we've seen Zach's thing, I think again, then it's a matter of running with any different disease terms that we can come up with. I'm not sure that I think this is something we probably need to run past Dr. Abbasi because he seems to describe. He tells me that there's 12. I'm not sure I've got 12 there. But it will be interesting to see what he thinks. You know, are there terms that are missing, and then we need to have a little look through the literature on that to see if there's again any other terms that we're missing. So any further comments, or do we think that actually in terms of next steps we're pretty close to it? So if I go, you know, next steps in here, probably just going to steal that table there, to be honest. So that is completed. I'm just going to delete that for now because I think we've done that. That's been done. I actually need to label that image. I can't find a better image than that one. I've looked through all my presentations. I can't create one that is so easy to look at. I can do a new CT scan reconstruction, but it's not going to be as clear as that one that I've shown you. So label different joints on image, and then the next thing after that, to be honest, is going to be add all different possible anatomic terms to each joint. So what I'm going to do is you'll get a diagram with a series of numbers on it, 1 to 8, 1 through 8, or whatever it is, and then we just need to create a list and say, and I'll produce a table with what I think we can put to it, and then we can add additional terms. So I'll do that as a table. I should be able to get that done pretty quick. So so yeah, so I'm going to circulate and circulate. So I'm going to give myself until tomorrow to do that. And once we've done that, effectively, it's going to, I think as soon as we see that, it will become obvious how the questions will come. Because if we do have the opportunity to write multiple choice, then it's instant. We just need to be sure that the Delphi process can run with a multiple choice format. That's the only question really. Because if it can, it's dead easy. It's super easy. And
Yeah, Zach, do you know about Delphi and the rank order, or Sarah Ann, how that gets worked through on a Delphi?
Yeah, so the program that we've purchased will actually provide all that. They'll run the statistics in the background as the Delphi questions are being answered and coming in. So Sarah sent out the Delphi for the length of stay, and she already knows that 7 people have started it and like 2 have completed it. You know, it's already given the stats on their questions, and then when it gets sent out, those, you know, like a true Delphi, it'll tell you, you know, what percentage of people voted for each of the choices. So yeah, so it's all there. It's being run in the background with this new program.
Okay.
Okay, so
the way that, so I don't know if this is the way that we want to do this, but I can tell you for the length of stay Delphi that we just completed, the way we kind of structured it was like 2 people. I had 2 medical students create the questions, and then I went through the questions. I kind of told them how to structure them, told them the topics that we wanted. They went through and they completed it. Then I revised their questions, and then I sent it out to the group to add or subtract or change the questions. So it was kind of like one source kind of created the questions, and then as opposed to like everyone trying to create questions and overlapping, I don't know, you know, if that would be redundant, and kind of like, you know, I don't want to waste anyone's time when it comes to the creating the questions.
Well, and I think it would make sense to send them to Dr. Price to look at. She's such an expert and she's so willing to review them. I think it would be to our advantage to use that resource.
Yeah, she actually looked at our length of stay questions and provided suggestions and edits and feedback.
You know, I think we absolutely should send it over to Price once we get what we think is a finished product.
how do I spell her name? I do apologize.
Oh, I'll send it to her because she's my
What's
peer.
her name, just so I can type it down?
Oh, her name is Michelle Price, Dr. Michelle Price.
Oh, Michelle Price. Okay, I think,
Yeah.
I didn't quite catch that.
Yeah. She's great.
That makes sense. So,
Yeah. And she's very swift. So if we get them to her, I can't imagine she would be more than a couple days.
okay. So that's kind of questionnaire preparation. And that's actually going to come later. That's going to go in there. So do we need to do any more? So literature search, I think we need to review the initial literature searches that had been done, don't we? Because and so we need to see Zach's. We need to make sure that we've have we identified any seminal characters that we need to include in the Delphi process?
I don't think there are any others. Dr. Erickson and I we chatted after this to see if we could think of anybody else that isn't already a part of the work group, you know. Obviously the work group has, or the bigger work group has so many, you know, experts in this field, or, you know, people that are really focused on this. And there are a couple other people that aren't already part of the work group, but I'm not confident that they're people that would want to engage further anyway. You know, they're people that, you know, seem to be fairly busy in their own world, and I'm not sure that we would gather any additional from this point, but.
So what I would like to suggest is, if I'm going to circulate those images, it would be nice to get those additional options populated on the image, perhaps over the weekend. That can be done by email. So I'm gonna suggest that we try and get that done potentially by June the 30th. Because then that allows us to make the questions, and I know we've missed that target, but I'm going to suggest that we revise that target to next time, and I'm going to ask if we're going to do a meeting next week. That would be even better. And then, because then we could well be in a position to review the questions by next week, which would be good.
Excellent plan.
So that's my suggestion, is that we those are our actions. I'll make a point of these extra bits here. I think those are discussion points, but not necessarily Delphi points at the moment.
Yeah, I think we probably should meet next week and, you know, try to have what we think will be a final product. We'll probably have a couple edits out of that.
Yeah.
That we can then do over the weekend, with the idea of getting it over to Michelle probably on the 7th. Because even if we were finished on the 3rd and we send it over, nothing's going to happen over that weekend, because over on this side of the Atlantic, we have a celebration of a small skirmish that happened between two different countries.
Indeed. Absolutely. So yeah, no, that's entirely appropriate. Okay. That's really helpful. Thank you, Julia. Thank you, Nathan, for joining. I think we'll definitely benefit from your viewpoints and your experience. So that's strengthens this little part of the project. So we carry on. Yeah, so I'll type. It's going to be very brief. It's probably going to be a one-page thing today. To you know, and to pass around. So there's not much to add to what we did last time, but we'll get that together and send that round very shortly. I can probably use half an hour to get that done even now, rather than sit chatting for another 10-15 minutes. Any other comments before we close?
No, John, are we going to do it via email or via Google Docs?
I think I'm going to try and do it via Google Docs, because that means that you can just put a stuff in whenever you like, and it's far more responsive than doing it through email, because then somebody has to put it together.
I will send. Oh, sorry. I'll send my literature search out shortly after this meeting. I will be honest, I didn't go through it like Nathan and Julia did and create a nice summary and a write-up. They spent a lot more extensive time than I did working on theirs.
We'll assign marks and compare and contrast in the next meeting. But no, that's
And
that's
Nathan's good at showing people up.
Oh, it would appear that way. Thank you, Nathan.
That's not true.
no, that's cool. That's great. That's really helpful. I'm gonna any other business? Anyone else want to bring anything up, or we'll dive out because I know you've got another meeting in a few minutes.
I think we're good. Let me know. I'll start setting up the template for the next one. And just let me know when you're ready to populate.
So when are the
Sure.
abstracts due for, is it November 1st?
Abstracts are due November 1st.
Good.
So keeping
And
it
in
snappy.
terms of just in terms of date and time meeting next week,
Yes. Do you want to keep this time frame?
it'd be good just to consider where we are. I mean, this is okay for me. It's just a matter. Let me just look and see what's going on next week. Sorry. I've got a steering committee meeting from this time is good or a little later, I don't mind. Same time next week's fine for me. Noon Mountain.
I'm good for 12 or 1 Mountain next week. What works for other people?
Any hard feelings? Same time next week?
If one works, that may help me because I'm in clinic, so I'm gonna have to move some stuff around and consolidate.
So
Okay.
an hour later next week.
If that doesn't give you any heartburn, John.
No, it's fine. That's cool. It's perfect. So that's good. Great. I will dive out and get making a diagram right now.
Okay.
Enjoy
It's gonna be amazing.
your next meeting. Oh, it's gonna be fun. It's good fun.
Are all the members so that I can start loading, are all of the members of the work group the people we're asking?
We're asking all the members of the work group. The question is there anybody else? We could put that to the wider group, I think. But I as I said, I need to look and see. I don't see any seminal authors that we don't know about in this space.
Yeah.
No, looking through the stuff that I saw, I didn't think we were really missing anybody per se. I mean, the few people I would think about with this would be Miller down in Georgia. Maybe
Yeah, those are the only others. You and I talked about Miller
maybe
and
Mario.
Gaspari. Oh, and McMahon.
Oh yeah.
She was the other one.
But I could
I can add those.
I can talk to them and see if they want to participate in it or not.
Don't necessarily. Well, it's up to you as to whether you want them to join the wide committee or whether you just want them to participate in and be recognized in that way. I'll leave it up to you.
Well, I have your email where you broke everybody up into the groups, so I'll include all the people that are on that email, and then I'll add those 3. Okay.
Well, let me talk to them, Sarah Ann.
Okay.
See if they want to participate.
Gonna be amazing.
And then we'll go from there. Yeah.
Okay. Thank you. Thank you.
All right. Awesome.
Good.
Thanks, guys.
Good stuff. I will look forward to our next contact. Take care.
Awesome.
Have a pleasant afternoon.
Thank you, everyone.
All the best.
Bye.
Bye now. Thank you, Judith. Thank you, Nathan. Thanks. Good evening, David. All the best. Bye now.